Oh my gosh, I don't know where to begin. It's really exciting. It is the one area of lung cancer care that has really revolutionized the outcome of patients for the better. For many, many years, lung cancer treatment was sort of stagnant and plateaued, and we really were not making much progress. And that all began to change in the early 2000s with the discovery of certain molecular characteristics and really understanding that lung cancer is not just one disease, but a very, very heterogeneous disease. And understanding that certain tumors harbor certain mutations, and developing drugs that target those specific mutations had a significant impact on outcomes. And that's sort of the era of targeted therapy, the EGFR mutations, the ALK translocations, the ROS rearrangements, really significant impact and continual progress in that arena, because we are discovering more and more molecular alterations and developing drugs targeted to those specifics alterations. Now, they're not that common. You know, the EGFR mutation is maybe 16 to 22% of all non-small cell lung cancers, but nonetheless, if you're a patient that falls into that category, the benefits of getting targeted therapy, personalized therapy are phenomenal. But what really has changed the paradigm of therapy and the outcome is immunotherapy. And the Nobel Prize winners in medicine announced last week, a gentleman from the United States and a physician from Japan discovered really important proteins in the immune system that sort of function as brakes, if you will, in the immune system to sort of prevent the immune system. The cancer cell gets really savvy, right? And they know how to turn on those safety brakes. It's like, think about it, your parking brake, so that the immune system is kind of, dampened. And they figured out that by releasing those parking brakes, those safety brakes, and developing drugs that would do that, the immune system, the power of the immune system against cancer has been realized. And we can harness that to develop drugs that enhance our own immune system, which is probably one of the most powerful tools that we have against cancer. And that has revolutionized cancer care, particularly lung cancer. We now have multiple drugs that have been developed to harness, to augment our immune system and fight lung cancer with very, very impactful results, really impactful. I mean, for the first time in decades, we are seeing 5-year survival in patients with metastatic lung cancer. The numbers are small, but that's remarkable. In my lifetime, I never thought that I would use those words in the same sentence. 5-year survival in advanced lung disease. And it's only the beginning, of understanding what the immune system can do. It's only the first layer. Think about, the next few years. That's a very important question. So along with the benefits of these therapies, which are phenomenal, we do have side effects, and in particularly with the immune checkpoint inhibitors, a very, very unusual manifestation of inflammatory diseases that can affect just about every organ, including the lung. So, and the incidence of these toxicities is increasing. We don't really understand in depth the mechanism of action or the mechanisms for these toxicities. I think we're beginning to understand what is actually happening. But I think there is a lot more awareness about symptoms, about radiographic findings that might imply immune therapy-induced toxicity, about other organ symptoms, because often these toxicities go together. So the person who develops colitis with diarrhea may also have respiratory symptoms that may be related to pneumonitis. So there's a great deal of work now ongoing to try to identify what potentially may place patients at risk for developing these toxicities, how to best detect them early, what is the biologic mechanism of action so we can develop better therapies to treat the toxicities, whether or not we can re-challenge patients once they've developed these immune toxicities. There's a lot that we don't know, but the work that's going into this field and the efforts are phenomenal, because the therapy is so impactful that we have to stay ahead of the game and think about how do we treat and manage the side effects, right? These are the challenges that, when systemic chemotherapy was first developed, it was very toxic, but you have to learn about the toxicities and understand them and how to deal with them and manage them so that patients can get through these treatments. You can't halt and say, oh, they're too toxic, and obviously we're not going to do that, but that area is still very much new, if you will, in terms of really understanding the biology of toxicity.